Hi, my name is Selvakumar. I'm from Department of Physiology, Faculty of Medicine, University of Malaya. Today I'm going to present my project entitled Protective Effect of Chloroprothom against hydrogen peroxide induced oxidative stress on the reproductive system in male mice. Infertility is a major public health concern for many couples worldwide. According to the latest International Glossary on Infertility and Fertility Care, infertility is defined as a disease characterized by failure to achieve a clinical pregnancy after 12 months of unprotected sexual intercourse. Infertility affects an estimated about 15% of couples globally and amounting to 48.5 million couples. 10% are due to both combinations of male and female factors. 40% are due to female factors, where the remaining 40 to 50% are due to male factors alone. Here is the world map showing the percentage of infertility per region due to male factors. In Asia, it is reported 37% of overall. In 2017, European Association of Urology have reported the causes of male infertility and the percentage distribution in 10,469 patients. 30% are unexplained infertility, 14.8% varicocele, 10.1% hypogonadism, 8.4% male-descended testes, 3.9% sperm autoantibodies, 2.4% erection or ejaculation problems, 31.4% others. One of the proposed mechanisms for idiopathic infertility is oxidative stress and ROS, reactive oxygen species. The first suggestion that oxidative stress might play a role in the etiology of defective sperm function came from one of the pioneers in modern andrology, Dr. John McLeod in 1943, where based on the systemic review by Agarwal and the team, elevated ROS has been found in 30 to 80% of male infertility patients. Oxidative stress in seminals develops a disturbance in the balance between the production of reactive oxygen species and antioxidant defense. ROS comes from varieties of sources, such as endogenous sources and also exogenous sources. The principal endogenous sources come from neutrophils, damaged spermatozoa, mitochondria, and macrophages, whereas the exogenous sources come from radiation, smoking, pollutions, and drugs. ROS. At normal physiological level, ROS are very crucial for reproductive function such as spermatogenesis, hyperactivation, capacitations, acrosome reactions, sperm-oocyte interaction, which is essential to achieve fertilization. However, when the balance between ROS and antioxidant are disrupted, an uncontrolled of ROS causes oxidative stress that adversely affect the sperm function through lipid peroxidation, protein modification, DNA damage, which will lead to infertility. Here is the conventional treatment of male infertility is used by doctors. However, when this treatment is used for long, we'll have a lot of side effects. So that's why we want to use alternative medicine where we use the natural products. In our project, we use Chlorophytum borivilianum. It's called Indian ginseng. It belongs to family of Lycaceae. It's claimed as an aphrodisiac and sexual stimulant. It grows in tropical and subtropical climates. It is a phytochemical which contains carbohydrates, fibers, alkaloids, saponins, and proteins. And here is the pharmacological effects, where it has the anti-cancer, anti-diabetic, antimicrobial, anti-arthritic, anti-stress, and antioxidant potential as well. Here is the objective to investigate the protective effect of aqueous root extract of Chloroprothom borivilianum against hydrogen peroxide induced oxidative stress on the reproductive system in male mice. We will investigate the basis sperm parameters, serum testosterone, FSH, LH, oxidative stress, and steroidogenic markers. Here is the study design. The 8 weeks ICL male mice will be divided into 5 groups, where it will induce with the 2% hydrogen peroxide, followed by the various treatment and CB100, CB200, and positive control DMF 25 milligram. Here is the result, the effect of CB on body weight, food intake, and water intake. As you can see, body weight, food intake, and water intake will decrease on day 7, where the body weight, food intake, and water intake increase in induced mice given CB100, CB200, DMF on day 14. Here is the effect on the sperm count and motility. Sperm count and motility decrease in hydrogen peroxide group. However, sperm count and motility will increase in induced mice given CB100, CB200 and DMF. Here is the effect on the sperm viability. The sperm viability decrease in hydrogen peroxide group. However, sperm viability increase in induced mice given CB100, CB200 and DMF. Here is some representative image of sperm viability. The effect on the host tail coil sperm. The host tail coil sperm decrease in hydrogen peroxide group, but it increase in the induced mice given CB100, CB200 and DMF. Here is the effect on the hormone. Serum testosterone decrease in hydrogen peroxide group, but it will increase in the induced mice given CB100, CB200 and DMF. Serum FSH and LH increase in the hydrogen peroxide group, but serum FSH and LH will decrease in induced mice given CB100, CB200 and DMF. Here is the effects on the lipid peroxide product called MDA. MDA intensity was highest in the hydrogen peroxide group, but the intensity was lower in the treated mice groups CB100, CB200, and DMF. Here is the effects on the steroidogenic markers. The distribution of the star in the green color relatively low in hydrogen peroxide group, but however, a relatively high distribution of star observed in the induced mice group given CB100, CB200, and DMF. Here is the effect of the steroidogenic marker on CYP11A1. The distribution of CYP rate relatively low in hydrogen peroxide group, but relatively high distribution in the observed in mice given CB100, CB200, and DMF. So as a conclusion, borivilianum root extract is protective against hydrogen peroxide induced oxidative stress on the reproductive system in male mice. Thank you very much.